Imagine waking up on an ordinary Tuesday morning. The sunlight streams softly through your window, birds are chirping outside, and you have a simple plan for the day: a little gardening, a short walk to the store, or maybe just enjoying a cup of coffee while reading the newspaper. Everything seems normal, yet when you try to rise from your bed, something feels different. Not exactly painful, but a subtle change in how your body feels. Maybe your legs feel a little weaker than usual, or your energy levels seem unusually low. Perhaps making that cup of coffee feels like a chore rather than a simple morning ritual. For many people over the age of 60, moments like these can easily be dismissed as just a bad day or simply a part of the natural aging process. But the truth is, sometimes these subtle signals are your body quietly trying to communicate something critical about your kidney and bladder health. Studies indicate that for older adults, the classic symptoms of urinary tract infections, such as burning during urination or abdominal pain, are frequently absent in a significant percentage of cases, sometimes up to 30 or 40%. In other words, the usual signs that would make someone rush to a doctor may simply be missing. Instead, these infections often manifest as quieter, less obvious signs. They're subtle changes, minor shifts that are easy to overlook until the problem becomes more serious. Learning to recognize these early whispers from your body can not only save you a trip to the hospital, but can also give you much greater control over your health and well-being. Hello, I'm Dr. James Miller, a specialist in senior kidney and prostate health, and I want to welcome you to Senior Health Protect. Today, we're going to take a detailed look at 7 silent signs of urinary tract infections in seniors, signs that often go unnoticed, and provide practical guidance on how to spot them early before they escalate. Let's begin with one of the most common yet often overlooked early indicators: sudden and unexplained fatigue. When we think of an infection, most of us imagine a high fever, localized pain, or discomfort that makes it obvious something is wrong. But as we age, our immune system behaves differently. Instead of mounting a dramatic, loud defense that results in high fevers and obvious inflammation, the body often fights a quieter, subtler battle. This internal effort draws heavily on your energy, leaving you feeling drained, sluggish, and unexpectedly exhausted without an apparent cause. Many seniors assume this kind of sudden fatigue is just part of getting older. You might think, "I didn't sleep well last night," or "I overdid it in the garden yesterday," and dismiss the feeling. While such explanations can occasionally be valid, fatigue related to a silent urinary tract infection often emerges abruptly. You might wake up feeling reasonably fine, go about your morning, and by early afternoon feel like you need a nap just to make it through lunch. Think of your body as a house powered by a generator. When everything is working properly, it keeps the lights on and all the appliances running smoothly. But if there's a hidden electrical problem in the basement, let's say an appliance is short-circuiting, the generator has to work harder to maintain power throughout the house. That extra effort, that unseen drain on energy, is what your body experiences during an infection. Your kidneys and bladder are fighting bacteria, your immune system is on high alert, and your muscles and brain are left with less energy to function normally. Here's a practical step you can take. Pay attention to your energy levels. Keep a mental note or a simple written log of how energetic you feel throughout the day. If you notice a sudden, sharp drop in energy that lasts more than a day or two, take a closer look at other signs: your hydration habits, how often you're using the restroom, and even the color of your urine. Fatigue can be your body's earliest whisper that something is off. I recall a patient named Robert, age 74, who loved woodworking. For years, his garage was his sanctuary, filled with tools and half-finished projects. One week, he stopped showing up in the garage. He wasn't in pain, he simply didn't have the energy to lift his tools. Initially, he assumed it was his heart, or just slowing down with age. A simple test revealed a significant urinary tract infection. Once treated, his energy returned, and within a week, he was back in the garage, cutting wood and sanding projects as usual. This story illustrates how fatigue can sometimes be the only early symptom, The next subtle sign to watch for is sudden confusion or mental fog. This can be one of the most surprising and alarming symptoms for seniors and their families. In younger individuals, urinary tract infections typically remain localized to the bladder. In older adults, however, the effects can spread. The blood-brain barrier, which normally protects the brain, may become slightly more permeable with age. When the kidneys and bladder are stressed by infection, inflammatory chemicals can enter the bloodstream, impacting the brain and causing sudden cognitive changes. This phenomenon, often called delirium, can mimic dementia or Alzheimer's disease, which can make it particularly concerning for families. The key difference is the speed of onset. While dementia develops gradually over months or years, UTI-related confusion can appear within hours. A senior might wake up sharp and alert in the morning, but by evening may be unusually forgetful, disoriented, or irritable. A common mistake is immediate panic. Families or seniors themselves might worry that a stroke or permanent cognitive decline is occurring. While these conditions require serious attention, sometimes the cause is far simpler: a urinary tract infection taxing the kidneys and affecting the brain. Hydration plays a crucial role in maintaining mental clarity. The brain relies on adequate fluids to function properly, and the kidneys need fluid to flush out bacteria and toxins. Waiting until you feel thirsty is often too late. By that point, your body's fluid levels are already below optimal. Sipping water throughout the day instead of in large amounts all at once helps keep both your mind and urinary system functioning efficiently. Before moving on, I'd like to ask you, have you ever experienced a symptom that seemed unrelated to the actual cause? Perhaps you felt extremely tired when you were actually fighting a cold or infection. Share your experiences in the comments below. Hearing about real-life experiences helps us focus on the topics most relevant to seniors. The fifth sign to pay attention to is changes in urine appearance or smell. This is something observable and measurable. Your kidneys act as your body's natural filtration system, removing waste and maintaining fluid balance. When an infection is present, bacteria and white blood cells enter the urine to combat the invaders. This can change the urine's appearance, making it cloudy or giving it a distinct odor. Normal urine should be pale yellow and relatively clear, like straw. If it becomes darker, resembling apple juice or tea, or develops cloudiness, this is a warning signal. Cloudiness often indicates the presence of immune cells or sediment, signaling the body is actively fighting infection. Many seniors make the mistake of attributing strong urine odors to something they ate, like asparagus, or assume it's just dehydration. While diet and hydration affect smell, the odor from infection is usually persistent, often described as fishy or ammonia-like. For men, prostate issues can also contribute, leading to incomplete bladder emptying, which creates an environment conducive to bacterial growth. A simple habit to support kidney health is to observe your urine consistently. Before flushing, take a moment to notice color and clarity. If you see cloudiness for multiple visits to the bathroom, drink a full glass of water to flush the system. Persistent changes after hydration warrant a conversation with your healthcare provider. Think of it like a garden hose. Debris stays if water pressure is low, but increasing the flow helps clear it out efficiently. Another common sign is increased frequency and urgency without much volume. You may feel a sudden, strong urge to urinate, rush to the bathroom, and then release very little. This happens because inflammation from bacteria irritates the bladder lining and urethra, making the nerves hypersensitive. Even a small amount of urine triggers the full bladder signal, tricking your brain. A frequent mistake is reducing fluid intake to avoid frequent trips to the bathroom. While logical on the surface, this actually worsens the problem. Concentrated urine irritates the bladder further, creating a vicious cycle of urgency. The solution is counterintuitive. Drink more water, not less. Diluted urine soothes the bladder lining and can reduce the constant sensation of urgency. Avoid irritants like caffeine, alcohol, and spicy foods, which can worsen the feeling of needing to go. I recall a patient named Susan, age 68, who faced this exact issue. She assumed her bladder was overactive and cut back on water while keeping her coffee and spicy meals. Once she switched to water and visited her doctor, her urgency subsided within days. Another subtle, yet critical warning sign is unexplained falls or balance issues. At first, it might seem unrelated to the bladder or kidneys. However, low-grade infections can impact blood pressure, hydration, and cognitive function, all of which affect stability. Seniors may notice increased reliance on walls or furniture for support. For older adults, falls can have serious consequences, so identifying and addressing the root cause is vital. Many seniors regain strength and balance once the underlying infection is treated, showing that the weakness is not permanent, but symptomatic of the body prioritizing the immune response. Finally, the mildest and most easily overlooked sign is simply feeling off, low-grade fever, chills, or general malaise. Seniors may not spike a high fever during an infection due to changes in their internal thermostat. Sometimes the temperature barely rises, or the only indication may be a sudden chill, unusual fatigue, or a sense of discomfort. Even subtle malaise is your body's early warning system. Don't dismiss a slight fever or unusual fatigue, especially if accompanied by any other signs like urine changes or cognitive fog. Early detection allows for prompt treatment and prevents more serious complications. One patient, Arthur, 79, felt inexplicably cold one October morning. He wore a heavy coat indoors, yet showed no other symptoms. His daughter insisted on a checkup, which revealed a UTI. Early intervention allowed simple treatment, and within days, he was back to his normal routine. This shows the importance of listening to even the quietest whispers of your body. In summary, the human body communicates in subtle ways. Fatigue, confusion, urine changes, urgency, falls, and mild malaise can all be early signs that your kidneys or bladder need attention. By staying hydrated, observing changes in urine, and tracking your overall energy and balance, you can catch problems early. Always trust your instincts. If something feels off, it probably is. I want to leave you with one question. Do you consistently drink water throughout the day, or do you wait until you feel thirsty? Small daily habits, like regular hydration, can make a huge difference in kidney and bladder health. This video is for educational purposes only and is not personal medical advice. Always consult your own doctor regarding your health concerns. Thank you for watching Senior Health Protect. I'm Dr. James Miller, and I look forward to guiding you through more tips for staying healthy, safe, and independent in the years ahead.